We are going to discuss uveitis in multiple viruses. Since the topic is briefly discussed in Gansky, uh, in cases of all these viruses, so we are not. The lecture is not going to be very long. Some of these are important, like rubella and measles, but others are only briefly discussed. So we are not going to discuss them in detail as well. We are just going to discuss the main features. Most of them are not clinically important, except for, of course, rubella. So let's discuss them. Starting with rubella or German measles, um, it is a common childhood infection and usually follows a benign and short-lived course. However, transplacental transmission of virus to the fetus from an infected mother can lead to congenital abnormalities of multiple organ system, with severity generally worse the earlier in gestation infection occurs. Latent rubella virus may cause chronic anterior uveitis, relatively unresponsive to steroids, and has been implicated in causation of post-uveitic syndrome. Reported ocular features of congenital rubella include cataract, anterior uveitis, salt and pepper pigmentary retinopathy, glaucoma, and microphthalmos. You need to remember all these ocular features of congenital rubella because this is a very common MCQ question in exam. So this is one of those things that you need to be remembered carefully. Next, we are going to discuss measles. Congenital infection with measles virus can cause spontaneous abortion of congenital systemic and ocular anomalies, including cataract and retinopathy. Infection acquired in childhood typically features conjunctivitis and epithelial keratitis. Occasionally, retinitis with macular and disc edema can occur. Subacute sclerosing panencephalitis is a late complication of measles infection, manifesting with chronic progressive neurodegeneration and usually fatal disease of childhood caused by measles virus. Posterior uveitis is common and may be the presenting feature. So, this is one of those things, the subacute sclerosing panencephalitis, which should be looked for, and posterior uveitis is something that is common with this. So, when a patient presents with measles and uh, loss of vision is something which is presenting complaint, retinal examination should be done. Next is mumps. Iridocyclitis and interstitial keratitis are rare complications of mumps. So the only thing that should be circulating in our mind is the rare complication. Next is Vaccinia, which is smallpox vaccination using the Vaccinia virus has been resumed for small groups as a result of perceived risk of bioterrorism. Though rare, a range of anterior segment manifestation has been described both from autoinoculation and vaccines and in closed contacts, although they remain only in the anterior segment. Next is Zika. Now, Zika virus is transmitted by an infected Aedes mosquito. The virus can be passed from pregnant women to her fetus, resulting in significant birth defects, including microcephaly. In congenital Zika, ocular effects include chorioretinal and macular atrophy, focal pigmentary changes in the macular region, optic nerve abnormalities, and glaucoma. So we have to consider Zika normally affects the posterior segment, and in adults with an acute infection, conjunctivitis is the most common ocular manifestation, followed by uveitis. The virus may persist in the lacrymal gland and other tissues of the eyes, particularly in the retinal pigmented epithelium. Last but not the least, Ebola. The Ebola virus, which is responsible for epidemics in West Africa, has the potential to cause clinical disease in sporadic outbreaks. In survivors, post-Ebola virus syndrome may result in ocular disease, arthritis, hearing loss, abdominal pain, and neuropsychiatric disorders. Uveitis occurs in up to one-third of survivors and may result in acute and chronic visual loss. This can manifest as anterior, posterior, or panuveitis, with most cases occurring within 2 months of discharge. Up to 15% subsequently develop cataract. So, optic nerve swelling has been reported to occur in 10% of survivors. 15% has cataract, 10% has optic nerve swelling. The virus has been detected in aqueous in the acute situation and can infect and persist in the retinal pigmented epithelial cells. Treatment with topical and oral corticosteroids is effective but needs to be started at the onset of symptoms to prevent long-term visual loss. So with this, we are going to conclude our lecture with these viruses. Since most of them, which, for example, Ebola and Zika, they are either confined to a specific area, and others which cause uh, Vaccinia and mumps, uh, which cause specific symptoms, they are not very common. So we are left with rubella and measles, and so those are the important things which should be remembered. Measles is very uncommon. Um, so is rubella, but the only implication which is left with rubella is if it occurs in the early gestation period in the mother. So the effect on the fetus is quite uh, uh, impactful and can cause cataract, uveitis, alternate macropigmentary retinopathy, glaucoma, and microphthalmos. So that's how we are going to end our lecture now. Thank you all. If you like the lecture, please subscribe to the channel and like the video. We are going to end the topic of viral uveitis here, and we are going to start with the fungal uveitis now. Thank you all.